think that the current state of healthcare information technology today, especially in the U.S., is I don't know what the right word is exactly, but it's petulant. It's a funny word to choose, but what I mean by that is that I think we have done a great job over the last, and it's been a decade, unfortunately, but over the last decade of getting healthcare IT deployed across enterprises, and we have doctors, nurses, other health professionals looking at healthcare IT. I don't think we've yet leveraged the potential to bring decision support and care coordination and all those sorts of capabilities into the hands of providers to the benefit of our patients. So I think we're on the cusp, but not quite where we need to be. And that's going to be an exciting 3 or 4 next years. The fear that I think many of us share about the state of healthcare information technology is that in some ways we've forced it a little fast into enterprises. And as a result, we've seen some of the cost, doctors and nurses spending more time in front of the computer, less time in front of patients, for example, health professionals spending more time outside of their normal hours, completing their work. That's a real cost. And the benefits aren't quite there yet for the patients and the providers. I don't think you'd find a doctor, for example, that would say, give away my access to electronic data. They all really value the improved access to patient data that they've achieved. But they're not happy with the cost of spending a lot more time documenting, which in part is due to the healthcare IT, and there's opportunities to improve that, but in part due to the regulations and the way that we've chosen to measure quality and to assess the amount of work that doctors and nurses are doing for reimbursement purposes. I think that the 2 things that are going to have a large impact in care and healthcare IT over the next couple of years. The first is the Internet of Things. The ability to deploy sensors in a wide variety of environments, and think not just about sensors on patients, but think about sensors in care environments that will help us understand the efficiency and effectiveness of how we deliver care, about the integration in a more robust fashion of the devices we already use every day to measure laboratory tests, to measure patients' physiology, and so on. The second thing, and everybody talks about this, is artificial intelligence. And I think that we are at the cusp where we have invested in healthcare IT. We have a much more robust set of structured and computable data available today. And then secondly, the technologies, both the software and the computing environments that have evolved to the point where things that simply weren't possible 5 years ago in terms of large scale, very high performance computing and applying techniques such as deep neural networks are going to make a huge difference in how we are able to support our care providers and allow doctors and nurses to focus on the unique addition they can make to care and take some of the simple things off of their plate and let the systems deal with those for the patients and the providers and support their care.